Managing ADHD in pediatric patients 6 to 17 years of age and adult patients 18 years of age and older. Narrated by Dr. Birgit Ammon and Dr. Frank Lopez. Dr. Birgit Ammon is a child, adolescent, and adult psychiatrist and the medical director of the Behavioral Medical Center in Troy, Michigan. Dr. Frank Lopez is a neurodevelopmental pediatrician and clinical researcher at the Pediatric Neurology and Epilepsy Research Center, now a part of Mednax Medical Group in Winter Park, Florida. Both doctors are paid consultants compensated by Supernus Pharmaceuticals for their work on Qelbree, viloxazine extended-release capsules. Today they'll share their clinical insight and personal clinical experience with Qelbree for ADHD in patients 6 years and older. Let's talk Qelbree. Qelbree is indicated for the treatment of attention deficit hyperactivity disorder, ADHD, in patients 6 years and older. Warning: suicidal thoughts and behaviors. In clinical studies, higher rates of suicidal thoughts and behaviors were reported in patients with ADHD treated with Qelbree than in patients treated with placebo. Closely monitor all Qelbree-treated patients for clinical worsening and for emergence of suicidal thoughts and behaviors. Important safety information contraindications. Patients should not take Qelbree with or within 14 days of taking a monoamine oxidase inhibitor, MAOI, because of an increased risk of hypertensive crisis. Patients should not take Qelbree with sensitive CYP1A2 substrates or CYP1A2 substrates with a narrow therapeutic range.
Qelbree can be sprinkled for our patients who struggle to swallow pills. The extended-release formulation provides full-day exposure. It's a non-stimulant, so there is no concern of abuse as evidenced in clinical studies. Before, if a child or an adult patient couldn't swallow a pill or capsule, but were a better candidate for a non-stimulant, they had no option. Having the ability with Qelbree to sprinkle the capsule is highly beneficial to these patients. It finally allows a non-stimulant to be a viable option for them, which is incredibly significant. Additionally, in the pediatric and adolescent clinical studies, which was ages 6 to 17 years, Qelbree met the primary endpoint of a statistically significant improvement in change from baseline of the ADHD rating scale 5th edition, the ADHD-RS5 total score at the end of the study, compared with placebo. In the adult studies, Qelbree met the primary endpoint of a statistically significant improvement in change from baseline of the adult ADHD Investigator Symptom Rating Scale, or AISR's total score at the end of study compared with placebo.
Qelbree was studied in 4 clinical trials. In one study of children 6 to 11 years of age, ADHD symptom score reductions were statistically significant for 100 milligram and 200 milligram doses beginning at week 1. In the study of adolescents 12 to 17 years of age, ADHD symptom score reductions were statistically significant for 400 milligrams beginning at week 2. In the flexible dose study of adults 18 to 65 years of age, ADHD symptom score reductions were statistically significant in patients taking Qelbree beginning at week 2. Individual results may vary.
Furthermore, inattention and hyperactivity impulsivity symptom score reductions were observed early in treatment. This is a definite positive aspect of Qelbree. My patients have tolerated it very well and successfully utilized it. However, it is important to be aware of the potential side effects and precautions. The most common adverse reactions, greater than or equal to 5% and at least twice the rate of placebo for any dose in patients 6 to 17 years, were somnolence, decreased appetite, fatigue, nausea, vomiting, insomnia, and irritability, and in adults, insomnia, headache, somnolence, fatigue, nausea, decreased appetite, dry mouth, and constipation.
There are several dosing options available with Qelbree based on age and tolerability. Dr. Amin will walk through recommended dosing and titration for ADHD patients 6 years of age and older.
For pediatric patients 6 to 11 years of age, the recommended starting dose is 100 milligram once daily. 1 week after initiating treatment, the dose can be titrated up by 100 milligram increments per week to a maximum dose of 400 milligram once daily based on treatment response and tolerability. For adolescent patients 12 to 17 years of age, the recommended starting dose is 200 milligrams once daily. 1 week after initiating treatment, the dose can be titrated up by a 200 milligram increment to a maximum dose of 400 milligrams once daily, based on treatment response and tolerability. For adult patients, the recommended starting dose is 200 milligram once daily. 1 week after initiating treatment, the dose can be titrated up by 200 milligram increments per week to a maximum dose of 600 milligram once daily, based on treatment response and tolerability.
Dr. Amin has shared some highlights of the Qelbree pediatric and adult data in patients 6 years of age and older. Let's hear from Dr. Lopez and Dr. Amin briefly about Qelbree in clinical practice with their patients.
In our clinical practice, we have seen many benefits. The most salient have been the longer duration, allowing for better coverage of the patient's needs throughout the day, and the efficacy in treating ADHD. On the one hand, seeing improvements in clinical trials is excellent, but seeing children and adolescents ages 6 to 17 years improve consistently in clinical practice, it's terrific. As a reminder, Qelbree is administered once daily.
Thus far, it's been as expected based on the clinical trials. I spend a great deal of time with patients and parents educating them about Qelbree, what to expect, what not to expect, the most common side effects and precautions, the dosing. To date, I have not witnessed any significant differences between my patients' experiences and the results of the clinical trials. It's been a very welcome addition to the non-stimulant medication class.